And greetings, everybody. I hope you are having a fantastic day so far. My name is Tanisha Johnson, and I'm so glad to be with you as your MC today for the 2025 Kinship Care Building Resilient Families Virtual Symposium. To give you just a bit of information about myself, I've been a broadcast journalist for nearly 20 years, and now I'm a media consultant along with PR consultant and a documentary filmmaker focused on women over 40 and the issues that they face. Today's webinar is being brought to you by the Ohio Federation for Health, Equity, and Social Justice and the Ohio Grandparent Kinship Coalition, two wonderful organizations statewide that are bold voices for communities and families all across our state. Now, as you may be aware, September is Grandparent Kinship Caregiver Month in Ohio. We would like to put a copy of the governor's proclamation on the screen so that everybody can see it. And of course, we want to say a great thank you and give appreciation to our governor for designating September in honor of kinship caregivers once again. And of course, it recognizes those who are raising children in kinship care to ensure their safety and well-being while providing a stable household for young people to thrive. Now, I'd like to turn your attention to our opening speaker, who will bring welcoming remarks from the Ohio Federation for Health, Equity, and Social Justice and the Ohio Grandparent Kinship Coalition. Please join me in welcoming OGKC co-president Lynn Stevens.
Thank you, Ms. Tanisha. Hello, everyone. Good morning. Thank you for joining us today. You could have been anywhere in the world, and you're spending your time here this morning with us, and we appreciate that very, very, very much. I'm Lynn Stevens, as Ms. Tanisha said, co-president of the Ohio Grandparent Kinship Coalition. I've been with the coalition a little over 20 years or so, and just believe in what we're doing. Fierce advocate for kinship caregivers and other caregivers who are caring for their children who are unable to live with their biological parents. So thank you once again for joining us. I'd like to just mention our other officers. We have Ms. Brenda Dewberry, the other co-president out of the Dayton area, Ms. Siobhan Jones, our co-vice president, and also treasurer out of the Columbus, Ohio area. We have Ms. Donna Jones, our secretary out of the Columbus area, and Ms. Barb Turpin, our long time member and board member out of the Columbus area as well. We do hope today's webinar will be informative for you. Hope you learned something that you can take back with you to use in your life and to help your life easier, because I know it is challenging as a caregiver. I just like to leave with one quote from Dr. Seuss that I like a lot. To the world, you may be one person, but to one person, you may be the world. And everyone who's a caregiver, grandparents, caring for your grandchildren, you are probably the world to your grandchildren and any other caregiver. Thank you for everything you do in the lives of children in our great state. And with that, I will turn it back over to Ms. Tanisha. Thank you.
Lynn, thank you so much for that. I want to turn it over now to Barbara Turpin. She's going to give us a few housekeeping tips at this particular point.
Thank you, Lynn, and thank you, Tanisha. Good morning and welcome to everybody that's joined us this morning. Like Lynn said, you could be anywhere in the world, and here you are with us. So we hope this is going to be a exceptional event for you. I'm going to give you information about the gift card recipients. I know everybody's looking forward to that later on in the program. Also, if you have questions or comments, you can put them in the chat, and responses will be provided during the event. The gift card recipient selection process was designed to be as transparent as possible. Each caregiver was assigned a number at registration, and we selected 11 recipients. Was done randomly by an impartial party, somebody who is not connected with either organization. The first selection that was made was assigned to receive the $500 gift certificate, the second one, and on down until we got to the last. The selected recipients will be announced during the meeting later on. Selected recipients must attend the entire event and complete an evaluation, and they will be verified after the event based on your caregiver status, attendance, and completion of the evaluation. If a recipient doesn't meet the requirements, another recipient will be selected who does meet the requirements. Gift cards will be mailed by Wednesday with a tracking, and recipients, please make sure the address you provided at registration is correct. Each Kinship caregiver panelist will receive a $200 gift card, which also will be mailed on Wednesday with tracking. And so we look forward to announcing those recipients and having a good event. Thank you.
All right, Barbara, thank you so much for that. We have the pleasure today of having some from our state legislature joining us. We are so glad that they would take time out of their busy schedules to join us on today. And so with that being said, I'd like to turn it over to Representative Dontavius Geralds. He's been definitely an advocate, I know, and even just in covering stories concerning kinship care and just what's been happening in the state legislature. And so at this time, if we can turn it over to Representative Dontavius Geralds, that'd be great. Thank you.
How you doing, everybody? Can you all hear me?
Yes.
Well, it is so truly an honor and a privilege to be here with all of you. I'm having a little bit of audio trouble, so I'm going to assume that you all hear me very well. And just really want to say thank you to the Federation, to the team for inviting me on. You know, this is a pretty near and dear issue that I care deeply about. My grandmother, Maddie Sue Geralds, was an amazing woman in her own right, born in the 1920s. And when my mom was young, she stepped in at many times as my mom was navigating finding a job to step in and raise us. And I carry the stories of sitting with my grandmother and learning how to cook with her and just all the things that come with being raised by a grandparent. But I also have many, many, many more stories of families, particularly my own family, my cousins being raised by their grandmother. And one of the things that I'm really big on is how do we make sure that kinship care is adequately funded, much like a foster relationship would be. How do we ensure that we are training our families to understand what the law says and what the law doesn't say related to kinship care? What resources and supports are available for those families so that ultimately they're not thinking about whether to pay for a prescription drug or to put together school supplies for their grandbaby who is going to school. And so I know these decisions are decisions that many of you on this call and on this Zoom or in this video conference make. And my job as a state representative is to really think strategically about how can we make your life better, not just you personally, but really the family unit, make the entire family unit's life better. And so we've been working on a number of initiatives in my office, one looking at grandparent, grandchild relationship or kinship, kinship related, grandparent related legislation to, again, mobilize the voices of grandparents who do serve in this role honorably and do it with sacrifice and do it because they love their grandbabies. But I also want to make sure that we're doing everything we can to really look at the structure, the funding structure as it relates to kinship. Obviously, there was a case, as many of you know, where it was found that how monies were being flowed to families were disproportionate when it came to kinship relationships. And there's a lot of work that we still need to do, working alongside Job Family Services and other community partners to really right that ship so that whether you're in a kinship relationship or in a foster relationship with a child, you should get support from the state. And that's something that I'm committed to doing because a better Ohio to me is one where every single family, regardless of their dynamic, is given the resources and tools they need for that family unit to thrive. And so I just want to say thank you to everybody. Again, I hope you hear me. I cannot hear you. For whatever reason, it's a little gargled, but I'm a champion and an advocate for this work, and I look forward to working with every single one of you. So thank you again.
Representative Gerald, thank you so much for sharing some insight, and thank you for your efforts in the state legislature. We know that all of that is super, super important. With that being said, as I get ready to introduce the next person, I just want to give a special thanks as well to Ron Browder. He is the board president of OGKC and the president of the Federation. When you talk about people and the work that they do, obviously they cannot do it by themselves, but we want to recognize Ron in his particular role in all of the efforts that he has made, and even as an advocate. At this particular time, I want to move on to our first keynote speaker, Rita Sorenen. She's the president of the Dave Thomas Foundation. For more than 30 years, she's worked on behalf of abused, neglected, vulnerable children, providing leadership on the local, state, and national levels, working to improve the juvenile justice and child welfare systems while striving to assure safe and permanent homes for North America's children. She's a nationally recognized child advocate. She's led the Dave Thomas Foundation since 2001 and the Dave Thomas Foundation in Canada since 2003. She's a member of several boards, including the Forbes National Council, and has received numerous awards and honors. She's been nationally known as a speaker and has been a speaker at numerous conferences locally and nationally. She's a graduate of the University of Louisville and resides in Columbus, Ohio. If you would, please join me in welcoming Rita Sorenen.
Thank you so much, Tanisha, and thank you to the Council and to the Federation for asking us to be a part of this today. We'll move to the slides, I think, and get started and move to the next slide. And I also want to say to Representative Gerald, we heard you loud, we heard you clearly, and we're so grateful for your voice in this conversation. Look, the work of the Dave Thomas Foundation for Adoption is woven tightly into the work that you all do every day and the experiences that you have. Our founder, Dave Thomas, who also started the Wendy's company and those square hamburgers and Frosties, was adopted. But his adoptive mother passed away when he was 5, and he spent much of his time growing up with his grandmother, Minnie. And so that notion of family for him was very much about extended family, kinship care, adoption, and all of that was woven into his becoming a national advocate. And we'll move to the next slide for issues that surround adoption and foster care and kinship care. As he was nearing the end of his time as the leader of the Wendy's company, he got very actively involved in these issues, and he challenged corporations to provide adoption and foster care benefits in their workplace packages. He advocated for tax incentives for adoptive and foster parents. He encouraged state legislators and federal legislators like Representative Gerald, to examine and rewrite their adoption and kinship laws and make sure that they were fair to families and supported families. And he raised public awareness through public service announcements and campaigns. And then he mobilized Wendy's restaurants in order to support this cause. So he is clearly our legacy founder, but really that person that got us connected to this conversation of adoption is not adoption without including the biological family, kinship family, and extended family members. And we'll go to the next slide. And he always said, and this is something that I carry with me every day, that these children are not someone else's responsibility. They are our responsibility. And I know that everyone that's presenting today, that advocates on behalf of these children, that works with them, believes these words, that we can't just think that these are our kids and families that aren't in our community. These are our community members. And we'll go to the next slide. And so he created the Dave Thomas Foundation for Adoption in 1992 to focus exclusively on certainly that whole picture of prevention and support for families, but to really narrowly focus on those children for whom parental rights have been terminated and they're now lingering in foster care waiting to be adopted. And our mission is to dramatically increase the permanency of those children. And by permanency, we mean legal adoption, legal guardianship, and certainly reunification when that's possible. With this vision that every child, not just some children, but every child, no matter their age, their circumstances, what brought them into the system, every child needs and deserves and has the right to a permanent home and a supportive family. And we believe that every child can move in that direction. Next slide, please. And so we do that through a number of strategic priorities, both actively through grant making, supporting permanency efforts, breaking down barriers to achieving permanency, whether it's at a policy or a practice level, raising awareness and dispelling the myths and misperceptions about children in care, about families, about extended family members, about the system, and elevating those issues that need to be addressed. Effort. And we'll go to the next slide. And so in our hearts, we believe as an organization that children belong with family, that we must provide non-judgmental support services and networks and resources to assure that families have access to the services and resources that they need, that we break down those barriers, and that we empower families to succeed and prevent that need for foster care placement at the very beginning. And so that's at the core of who we are. We're the Dave Thomas Foundation for Adoption, but we fervently believe that children first belong in families, their families of origin, and we need to do everything possible to keep them there first. And we'll move to the next slide. And we also know, certainly intuitively, but by research too, that when we make sure that children are in kinship care situations, whether it's because they're in foster care and they've moved there, or they're simply temporarily being, or perhaps permanently being raised by kin, but haven't moved into the foster care system, we know that children experience fewer behavioral problems, that they're as safe or safer from any kind of repeat maltreatment when they're with extended family members, that they perform better in school and they engage in less risky behaviors, and that kinship caregivers preserve those very essential identity family ties and provide that continuing sense of family support, and that they are subject to fewer child welfare placements if in foster care they're placed with kin. So there's all kinds of research out there, and we'll go to the next slide as well, that shows that this moves to better outcomes for children rather than, if they're in foster care, moving them to stranger, for example, foster families. We also know that when we move to adoptions, kin adoptions, that they're much more stable when the adoptive parent and the adoptive child had a relationship prior to the adoptive placement, whether that's extended family members or someone already known to the child. And there was a study, it was done some time ago, but it still holds true, that although 19% that we know of relative adoption placements disrupted, when we compared that to cases where there was no prior relationship with the adoptive parent, 39% of those cases disrupted or fell apart. So clearly, better outcomes are both the goal and the result of striving for extended kin placements, of extended family member placements at all turns. And next slide, please. So part of what the Dave Thomas Foundation for Adoption does in the adoption world is move toward a sense of how do we assure that the 20,000 children nationally, year over year, who leave foster care, whose parental rights have been terminated, they have sat in foster care sometimes for years waiting for a permanent placement, and then they age out of foster care. How do we change that dynamic? And the Dave Thomas Foundation for Adoption a number of years ago really began to look at what was happening in that dynamic of children aging out of care. And we know that there's the potential for negative outcomes, a higher risk of homelessness, a higher risk of being undereducated or underemployed, a higher risk of substance abuse or early parenting, all of those things that can be mitigated by the supportive network of family. And so we began to look at where were the best practices, where were the evidence-based practices for children aging out of care, or children at risk of aging out of care, but moving them to permanency. And those children most at risk of aging out of care, of course, are older youth, teenagers, children in sibling groups, children with special needs, and children when a judge asks, do you want to be adopted? They resist that sense of adoption and just want to get out of the system. Understandably, they have no reason to trust family or adults, quite honestly, given the length of time that they've been in care, the multiple moves that they have, the separation from families they've typically experienced. So next slide. In 2004, we pulled together a pilot project that we called child-focused recruitment that really turned what was happening in terms of adoption recruitment on its head at the time. And we started with 7 pilot sites in 7 cities and used this child-focused recruitment model and gave funds to an organization to hire a full-time adoption professional that would use this model. And what it does is, instead of putting a child, for example, on a website or hoping with a general recruitment and bringing people to the organization to foster and adopt, that we do a deep dive and we get to know the child and we explore their history and their pre-existing relationships to find relatives, extended family members, former foster parents, neighbors, mentors, other folks that have been involved in this child's life. And rather than seeking the right child for the family, we seek the right family for the child. And we won't use public displays, but we'll involve the youth. Their voice is critical. And so with the next slide, you'll see just a sort of workflow of what this model does. If we can move to the next slide. And what it says is, the child-focused adoption recruiter, and I will tell you, we call the program Wendy's Wonderful Kids because we are the charity of choice from the Wendy's system. That was one of the gifts that Dave Thomas gave us. And we asked them to, if they could increase their fundraiser, we could provide these grants to organizations to hire these professionals. And so we called it Wendy's Wonderful Kids, but the model is child-focused recruitment. And the workers go through this very specific model of carrying a much smaller caseload of children, 12 to 15 at a maximum, so that they can have routine and regular communication with their children, so that they can get to know the youth on their caseload. And then they can do this deep dive, not only into the child's case file, but understanding the youth's voice and listening to who's already in this child's life. What family members might there be that the recruiter could reach out to for extended placement, and then builds this network with all of the children in the people's lives, makes sure that the child understands the value of adoption, the value of permanency in their life, and then prepares both the child and the families who step forward, and sticks with this youth for as long as it takes to move them to permanency. And so we'll go to the next slide. And what we know and what the recruiters do is there are specific tenets within this model that have to be followed. And one of those is we have to work to maintain contact with kin, culture, and community, because it's essential to the identity of the child and the family. It does help mitigate the trauma that's been experienced, and it helps promote healing. It certainly preserves that cultural identity, maintains relational permanency. Even if that family doesn't move to adoption, for example, it creates those connections with family members that might have been lost. And most essential, preserves sibling connections. And there's all kinds of course, research sources that say that this is the right thing to do. And it's become embedded in the work of Wendy's Wonderful Kids. And we'll move to the next slide. And critically important, we engage youth voices. And this slide is a bit in the negative, but we know that when we don't support and cultivate family relationships, the youth that we work with report that they've lost connection with siblings, or they don't maintain sibling relationships. There's no assistance to maintain those relationships with relatives who perhaps couldn't provide placement, but they also then, folks didn't go that extra length to say that they can still be in this child's life. There's this urge to run away and go back to their bio family or their extended family members anyway. So why wouldn't we provide those connections? And those just real feelings of anger or loss or grief that are ongoing with any adopted child, perhaps, but particularly when we intentionally keep them separated from families and supportive placements. And we'll go to the next slide. So we know empowering youth in this process leads to better outcomes. We know that it reduces disruption rates, it enhances their own sense of well-being, it provides meaningful engagement, it uncovers, and I can't say this enough, it not only uncovers but preserves those viable and important connections that a youth must have. It gives a sense of more informed and sustainable decision-making. It helps with this sense of control that when a child says to a judge, I don't want to move to permanency, I don't want to be adopted, it's because they've lost a sense of control over their life. And this helps bring that back into their lives. It helps, the program helps to address those fears and misperceptions. We know that many youth don't want to be adopted because they don't want to have to change their name or move again or feel disloyal to their family of origin. So that when we empower youth to help us get connected to extended family members, while we do that deep research, then it addresses and helps mitigate those fears and misperceptions. Certainly addresses systemic bias and inequities in the system, and just improves the sense of collaboration and trust. And we'll go to the next slide. The Wendy's Wonderful Kids program also uses a trauma-responsive lens with youth. And again, I won't go through all of these, but for all those same reasons that we've already gone through, by giving youth a voice, by validating their need to be in their community and with their family, by reconnecting with lost and relationships and helping to restore broken ones, we move to making sure that a trauma-responsive lens is a critical part of what happens with these youth. And so I've got a video that I want to show that really brings all of this together, I think. And so we'll move to the video.
I was in foster care for 9 years. It's very sad knowing that you don't have your real family there to hold you and say they love you and all of that. And one point they said that I was going to max out in foster care, and I didn't want that. So that's when Miss Chelsea came along and told me that she's with the agency that helps kids to get adopted.
She was so excited. She was like, when am I going to see you next? When's our next visit? And it was exciting for me to see that she wanted a permanency. She reached under her mattress and she gave me a folded up letter that was folded maybe like 20 times. And she handed it to me. She's like, I think on this letter are some of my family members' names and numbers, but here you go. And she slid it to me.
A few weeks later, Miss Chelsea, she was like, I got some good news for you. She was like, well, I have a family member, she's your aunt, that she wants to see if she can adopt you.
I had no clue she was in foster care until she told me. It was really shocking, and it was heartbreaking to know that that's where she was and no one knew.
I was always to myself. But when I got around my mom and the rest of my family, I started opening up, actually talking to people, not being sad. I feel strong.
She has so much confidence now.
Oh, now she is full of joy, full of excitement. I have seen her change dramatically since first meeting her.
We know Kenya is gonna go to college. She wants to be a veterinarian.
I know I'm gonna be a veterinarian because I have people by my side who's gonna help me. My adoption has changed my life a lot.
So it just sums up that power of trusting a youth's voice, that she had this piece of paper crumbled with her for as long as she had been in care. And it wasn't until someone created a relationship with her, someone she trusted, that she was able to find an aunt who was able to move her to permanency. So we put the Wendy's Wonderful Kids program through a rigorous national evaluation. It felt like it was working. I told you we started the pilot project in 2004. By 2007, we had a footprint in all 50 states, and we had enough recruiters in place that we could do a rigorous 5-year evaluation, comparing the work of Wendy's Wonderful Kids against whatever business as usual in the same jurisdiction existed for children waiting to move to permanency. And what we found at the end of 5 years is that on average, a child served by this program is about 1.7 times more likely to be adopted. But for older youth and youth with particular mental health needs, it was more than 3 times more likely that they would move to permanency, which is a huge shift in child welfare. And critically, what we found is when we did interviews with the youth through this program, youth that were previously opposed to adoption or permanency were more likely to consider adoption once they had been working with a Wendy's Wonderful Kids recruiter. So that put us on the next slide on a path to saying we have to scale this program. And in other words, we have to have enough resources and enough recruiters across the nation to serve every child that could benefit from this intervention. And we've created unique public-private partnerships here in Ohio. We have 88 of those recruiters in a partnership with the department who have moved more than almost 2,000 children to permanency. And across the nation, we are now scaled or scaling in 20 states and 1 province in Canada. And we've moved 5,615 youth to permanency. The average age of a child moving to permanency in this program is about 13 or 14. The majority have been moved with their siblings. About 76% of the children had siblings that they needed to be adopted with. And so it's really critically working for that very population that we had hoped that it would work for. And we'll move to the next slide. And for the children that have moved to permanency through Wendy's Wonderful Kids nationally, 73% of the permanent families formed through Wendy's Wonderful Kids were families that were connected with either a relative or someone already known to the child. And that's significant because that wasn't the case prior to Wendy's Wonderful Kids. And if we move to the next slide, in Ohio, it's just a little bit lower, but 62% of the permanent families formed through Wendy's Wonderful Kids were connected to or related to the youth. So we want to continue to grow this program. We want to continue to make sure that even more of the children, that sort of general other 32% in Ohio, should get reduced significantly as we continue to strive for a kin and culture-centered approach to Wendy's Wonderful Kids for every child. And we'll move to the next slide. So this sums it up, and we're going to tell this story next in a video. But when you search for, and when Wendy's Wonderful Kids recruiters search for biological family and extended family members, they go in without judgment. We give them that blank slate that they deserve so we can assess where they are and make sure that this family can get connected to the youth. And we'll move to the last video that exemplifies this beautifully.
And Jemiah was frustrated because she felt like nobody was listening to her. She was 14 years old, so she was young, she was pregnant. She had emotions all over the place. But one of the things that I noted in my getting to know her was that she only talked about her mother. Everything was about her mother. When you search out a biological family, go in without any judgment. Go in with giving them a blank slate until you actually can assess and learn where they are. Lakeisha had some anger initially, but once I broke through that she opened up beautifully, and everything I needed from her, she began to provide to me. She's very transparent about her own story and what she's gone through. She did have a job. She had her own apartment, and she was actually working on buying a baby bed and just some different little things for her granddaughter. She did some of the work she needed to do for herself. She had matured some over the years. Once she found out that we were considering her mother, she totally changed. We had a celebration, and she actually said, "Miss Jocelyn, I'm gonna give you a front hug. I don't do this, and I'm not gonna ever do it again. So this is gonna happen one time. Are you ready?" So she gave me a hug. The sadness, the depression, the lack of interest that she showed in doing things, a lot of that went away.
I mean, she did something that was heaven sent. She actually answered a prayer, and I thank her so very much.
At the Dave Thomas Foundation for Adoption, we don't underestimate or undervalue the power of family, the power of connections, the power of culture and community. And we work every day to make sure that that's a part of the permanent placements that we work for. Thank you to all of you who are a part of this. Thank you again to the Federation, to the Coalition, to the representatives and senators that are fighting for this every day. And thank you for each of you for sharing your stories and sharing your time with us today. Thank you.
Rita, thank you so, so much for sharing not only the information and the data, but the powerful stories behind everything. And I learned quite a bit, and I'm sure many other people who were on here as well did too. So thank you again, just for sharing that information. And for whatever you've heard, if you're online here today, I hope that you will take that information and share it with somebody else as well. Rita, thank you.
Of course.
All right, with that being said, let's turn it over now to Senator Herschel Craig. Thank you so much for joining us today. We appreciate your time.
Good morning. I apologize to you with regard to my lateness. We had a press conference this morning around redistricting, and this is an issue that certainly will affect all Ohioans. But this issue is so important to me with regard to kinship. I want to thank all of you, number one, for what you do for our families and our children. And so this is just not a piece of legislation, a piece of parchment, but what we're talking, when you roll it back, we're talking about families and children, making sure that they're strong, that they have the resources that they need, and that not just survive, but thrive. And we know with families, my son-in-law, his mother died, and his father had died before that. And he raised nine of his siblings, and two of which now have doctorates. But all the travails and the struggles that he's gone through. A young man in his early 50s now. So this is just not an esoteric experience or just something to say. But the work that you're doing is so vital. What it will mean for all of our families is so important. It gives the caregivers the legal authority to act quickly on school enrollment, medical care, essential needs, ensuring children don't fall behind or go without their care. And so today's meeting is so vital. It is so critical. And apologize to you. I'm kind of running. We've got back-to-back meetings this morning, but I wanted to personally be able to connect with you and thank you for all that you're doing to you strengthen our families to make sure that our families, our children, our seniors, everyone is whole, because we know life happens. And we want to make sure that there are the appropriate resources and a process in place that makes sure that we can continue and strengthen and have quality of life for all of our families. So God bless you, and I'll stay on for just a bit to see if there are any questions with regard to the legislature and where we are right now.
Senator Craig, thank you so much again for your time and your busy schedule as well. Quickly, I would like to turn it over now to Anna Beltran. She's the director of the National Grand Families and Kinship Support Network for a national perspective. She is also an attorney and an expert on grand families and has authored several articles in Generations United publications and in various national publications. She's spoken extensively as an expert on grand families and has authored several articles in Generations publications again. But as someone who was raised in part by her grandmother, Anna has a personal commitment to family. So if you would, please join me in welcoming Anna Beltran.
Thank you so much for having me today. I've really enjoyed listening to all the speakers before me, and thank you to the Federation and to the Council for having me today. I want to talk to you a little bit today, give you a little national perspective of what's going on with kinship, which is quite a bit. And we can go to the next slide. I start with this definition because we often talk about grand families, we talk about kinship families, and want you all to know that we use those two terms interchangeably. So when we say grand families, we're not just referring to grandparents. For both terms, we're referring to grandparents, other relatives, close family friends who raise children when parents can't. And there's a glossary on our website of all kinds of terms, because we know that some of this terminology can get very wonky and specific, and that we like to level the playing ground by everyone understand what we're talking about. So just starting with that. On the next slide, you'll see the children who are in these families. And again, I'm using those terms interchangeably, kinship and grand families. And what you can see from this infographic is there are about 2.5 million children around the country who are being raised in these families. And you see that small little circle, and that small little circle is the number of children being raised by grandparents and other relatives and close family friends in foster care. So those children are in foster care with their relatives and kin. And although that looks like a small number, you'll see on the next slide that it's actually a big percentage of the foster care population around the US. So well over a third of children in foster care throughout the country are with their relatives and kin. And why? Why are we placing them with relatives and kin? Well, for a lot of the reasons that Rita talked about. And on the next slide, you'll see that this is kind of a summary of the research that Rita shared, which is that children thrive. And we have decades of research showing this, that comparing children in foster care with relatives and children in foster care with non-relatives, and the amazing outcomes for those that are with relatives and kin. Things that are kind of common sense, that they maintain cultural connections, that the smells emanating from the kitchen are the same, that grandma, I know grandma, or I know my auntie, or I know my coach or teacher. They keep me connected to my culture, my community. So all those kinds of things that are obvious in a way, but then all those things that Rita talked about that are less obvious, but are well documented by the evidence, that these children have better outcomes all around. So feel free to use these links at the bottom of the page. We have kind of a summary of the research and also a very updated resource on the strengths and challenges of the families. And we find that piece is very helpful when talking to policymakers and the media to give kind of the general overview of the families. On the next slide, we will see this very, very busy timeline. And I don't expect you to be able to read this on the screen, but do know that for the last 30 years, we've seen amazing progress. Is there still a ton to do? Yes, there is. But all the way back from when TANF, temporary assistance for needy families replaced aid to families with dependent children. So that welfare, quote unquote, reform law, that includes a preference for placing children who are in foster care with relatives. So that has been the law of the land for almost 30 years. All states have some type of preference for placing children with relatives in foster care in their state laws. And so that has been around for a long time. And we have seen progress over the years for families who are in foster care and families who are not in foster care, which are, as we saw in that earlier infographic, the vast majority. There are about 18 children outside of foster care with relatives and kin for every one in foster care with relatives or kin. All the way, this timeline goes all the way up until the new kin-specific foster care licensing standards and the creation of the network where I'm speaking to you from, which is the Grand Families and Kinship Support Network. And we're the first and only federally funded National Technical Assistance Center on the families. So there's progress, there's more to do. And on the next slide, you will see kin-specific foster care approval standards. So this is something that a number of us, our partners, have worked on together to create in response to a federal rule allowing for separate foster care licensing standards for relatives and kin. Standards that address the strengths and needs of these families. Because in many jurisdictions, and you may have seen it on the little banner on one of those slides, in many jurisdictions, children are placed by child welfare with relatives and kin. So the child is in the legal custody of the state, they're in foster care, they're placed with a relative or kin, but the state doesn't license or approve that kin. So that kin does not get foster care maintenance payments because that's tied to licensing or approval. And this has been going on for decades. And in 2023, 60,000 of those 131 odd children were in these unlicensed, unapproved homes, subject to all the rules and restrictions of foster care. So this isn't hidden foster care, subject to all those rules and restrictions, but not getting foster care maintenance payment to help the caregivers meet the needs of the children. So on the next slide, you'll see some of the benefits of these kin-specific licensing standards. Also, you have to be licensed for that pathway to supported guardianship assistance. So there are just many reasons that we're excited about kin-specific foster care licensing. On the next slide, you will see the jurisdictions that in 2 short years, because this became a federal rule allowing for these separate standards, just not even 2 years ago. So in 2 short years, you can see in on the color coding how many states and tribes have moved forward with this federal flexibility. Next slide, please. So I want to focus the time that we have together on those 18 children. So the 18 children outside of foster care for every one child in foster care, because there's so many more of them and they're even less likely to be supported. And unlike those children who are in foster care with relatives and kin, so the state has legal custody of those children and can facilitate access to school enrollment, to health insurance, to health consent, all of those things, even if they don't get foster care maintenance payments. But those families outside of foster care, the legal custody is still with the parent because the parent has automatic rights and responsibilities over that child. So until the relative or kin goes to court, and that takes time and money, and gets legal custody or legal guardianship or adopts, the custody remains with the parent. So there are all kinds of challenges there. Now, there are temporary solutions, and Ohio has some of them, including power of attorney that can be turned over to the caregiver. But they're temporary, and so going to court takes time and money. Moving to the next slide, we can see that for those families that are outside of foster care involvement, often the only source of ongoing financial support is temporary assistance for needy families or welfare. And often the only source of support within that program are child-only grants. So that means the grant is for the child, just based on the income of the child, and for the child only to meet their needs. And those grants aren't subject to work requirements and time limits, so the child should be able to get that payment until they become an adult. What's the problem? The problem is it's still a lot smaller than foster care maintenance payments. And we know how much it costs to raise children, and these payments do not get there. Ohio has a higher rate than the national average, which is great. But like every other state in the nation, and this is not required by the feds, by the way, but like every other state in the nation, the TANF child only payment is not per child like foster care maintenance payment. So it only rises a little bit for more children. So that's when it becomes really impossible or really challenging financially to raise a sibling group. Because you can see down on this chart, when it gets to 3 kids, how does grandma or auntie or godmom do it and help meet these needs of the children without extra income? So it's challenging, but there are things we can do. And on the next slide, you will see we've done some research using public data sources and with our partner Child Trends to analyze what's going on around the country. And you can see Ohio is squared here. And as I mentioned, your child only payment is fairly high compared to other states, which is great. And also, you have a much higher percentage of children with their grandparents and other relatives who are able to access the TANF child only. So almost 50% of children with their kin, the data shows anyway, are able to access TANF child only in Ohio, whereas nationally that's only 13%. So that's definitely cause to pat yourself on the back. Of course, there's always room for growth. And as you'll see on the next slide, we've these are 2 pieces that we released earlier this summer. I guess it's no longer summer, but anyway, in June. One of them is with our partner Child Trends, and it summarizes that state data that I shared with you. And the other one gives state strategies. So strategies for improving TANF child only access. And as I said, Ohio is definitely doing better than most, but there's always room for improvement. And on the next slide, you'll see a couple of things to consider. One of the big challenges for accessing child-only grants and TANF in general is that caregivers have to assign their right to collect child support to the state to go after the parents. And Massachusetts and Wyoming have blanketly exempted all relative caregivers, all kinship caregivers, from having to assign child support to the state. Because this can be a big barrier, right? Because not so much that some are, but not so much that the kin are concerned that the parents will get violent or yank the children back, but more that the caregivers are often supporting those adult children, the parents, or hoping that they are able to reunify with their children. And if you yank some of their income away, it can really jeopardize that. So those are 2 examples to look at. And then also extending to non-relatives. And I know that Ohio has extended to non-relatives the ability to access TANF if they have legal custody or guardianship. But there are, as we kind of touched on earlier, that takes time and money. So you could families could be without financial assistance for a very long time. So here there are a couple of other examples of states that have gone a little bit further, and perhaps there's room for growth or room to consider that option. Moving to the next slide and kind of shifting gears a little bit, but I do want to elevate this because I've spoken with you all in Ohio many times and with the coalition, and I enjoy it every single time, although I wish we were in person. But anyway, and this has been a recurring thing, but just to know that the educational and healthcare consent laws that not every state has, and so again, pat yourself on the back for having it, but Ohio is the only state that has one of these laws that limits it to grandparents. And I know there's pending legislation, but just want to elevate that with you all and also share this table with you so you can look at other state examples. And these are all, I know you can't click on these links on these slides, but these are all available on this toolkit. And I know that they're going to share these resources with you after we are done today. On the next slide, you'll see Kinship Navigator programs. Now, we know how important Kinship Navigator programs are, and I know that you have a couple of very good programs, several very good programs in Ohio. but I do want to elevate some of the models here that are already in that Title IV-E Prevention Services Clearinghouse, which means that those models can collect ongoing federal money up to 50% of the costs of running that program. And also states can follow one of these models with fidelity and also draw down 50%. And this doesn't cut into any other federal funding. This is new federal funding, essentially. On the last slide, if you go back just a second, there has also been non-competitive 4B money for many years to enhance and develop these programs. Well, on the next slide, you can go to the next slide now, there is a new federal law that went into, that was passed and signed into law earlier this year, and it goes into effect, starts going into an effect next month. But that 4B, which I know Ohio's gotten every year, non-competitive 4B money for these Kinship Navigator programs, is now going to be competitive. So it's only going to be, there's going to be $10 million in grants going out to states, and requests for proposals going out to states and tribes for this competitive opportunity. So know that that's coming down the pike, and that you might want to prime yourself for applying for that. And this, for the first time, is open to lead agency being a nonprofit organization or a university. Next slide, please. Now, I want to tell you about what's going on in the aging sector. So in the aging sector, I have the privilege of sitting on the Supporting Grandparents Raising Grandchildren Federal Advisory Council. And that council's been going on now for about 6 years. We're in the second seating of the council. And as part of that work, a national caregiving strategy was developed. And this was developed with a sister council called RAISE, which is focused on family caregivers. So caregivers of older individuals. But together, we ensured that grandparents and other relatives raising children are included in the definition of family caregiver in this national strategy. So it's another way that we've been able to elevate kinship families as part of the ongoing work that's happening to support family caregivers. And you'll see on the next slide a little bit more about the Supporting Grandparents Raising Grandchildren Council. That council includes people like me, but also many grandparents and other relatives who are raising children, really leading their expertise to this work. As a matter of fact, our council chair is a grandfather who's raising grandchildren, and a number of federal agency representatives. And what we've done is collaborated on that national caregiving strategy, and also we're updating it and working to implement it. And there's all kinds of information there on that link at that website. But you'll see on the next slide that we have also created a number of tip sheets that are directed at the caregivers. So these should be helpful to caregivers on this webinar and those who work with them on this webinar. Particularly the tax credit one, I want to elevate that one because there has been a change since that tip sheet came out. And now, for the first time again in, I guess, 10 years, $5,000 of the adoption tax credit will be refundable starting in tax year 2025. And what that means is there's been this adoption tax credit for many years, as Rita can tell you all about it, but it's roughly $17,000 a year now. And if you adopt from foster care, you can claim that whole tax credit without any receipts. But if you adopt privately, you can also claim it, but you have to have receipts. And it can be receipts like court fees, lawyer fees, transportation to the courthouse, if it's far away, a night at the hotel for the court hearing, all that type of stuff. But it has very much helped people who owe enough to pay taxes, but it hasn't helped in a long time those who don't owe enough to pay taxes. So now it'll be refundable. So that means if you don't owe enough taxes, you'll still get $5,000 refunded. So just want to really elevate that because that's an important new change. It won't help us this year, but it will help us next year. Now, how can we help on the next slide? Well, I just want to tell you a little bit about us at the Grand Families and Kinship Support Network. Next slide, please. We've been around now for we're almost at the end of our 4th year, which is just amazing to me how time has flown. But we were funded through the U.S. administration. We're in a cooperative agreement with the U.S. Administration for Community Living, which is at the U.S. Department of Health and Human Services. It's been a real privilege to work with them, but that's just a little aside. And what we do is work with the systems that impact the families. So we know that at least these 8 systems here in this umbrella impact the families, but there's no one system that kinship families go to for the supports and services they need, particularly those who are outside of foster care involvement. So what we're trying to do is really support all these many systems and help them support caregivers better. So we provide all kinds of, as you'll see on the next slide, individual assistance. Again, this is all free of charge. So we have people who reach out. Yesterday, I had the privilege of talking to Alaska, who wants to enhance their use of TANF. So we do all of that, again, free of charge. We have a website where we have a lot of information, including a lot that I shared with you today, again, free of charge. Many webinars. We've had 34 webinars. We counted them up the other day. I couldn't believe it'd been so many in 4 years. But they're all recorded and available, again, free on our website. We have one tomorrow, as a matter of fact, on nutrition supports for kinship families, led by one of our subject matter experts. So I encourage you to log into that. And then we're working intensively in 3 jurisdictions. So we have been working now for over a year in Idaho, in San Diego County, and in the Oneida Nation of Wisconsin to help them bridge those systems. So those systems in that big umbrella, help them bridge those systems so that kinship families are better served. When we first started working on these, when we first launched the Technical Assistance Center, we had these meetings with every state. And I can't tell you how many states would get on there and there'd be a system like TANF verbatim. Well, this is all very interesting, but we don't have any of these families. We don't have any of these families on our caseload. And again, it was the problem of, well, you don't call them kinship, you don't call them grand families, but yes, indeed, you have them and you need to better support them. So that's why we're here. If you go to the next slide. We are celebrating National Kinship Care Month, and we have a free toolkit for anyone to join us and get involved. Hashtag Kinship Month 2025. So please join us in celebrating the many, many caregivers and children that they raise. And finally, on the next slide, please stay connected with us. So you can sign up for our monthly newsletter that'll come into your inbox. And we don't just share our resources, we share resources impacting kin from around our partner agencies and around the country, really, and a lot of funding opportunities as well, believe it or not. Again, request assistance. And please follow us on LinkedIn. We have a very active LinkedIn page, not other social media, but definitely on LinkedIn. And just a pleasure to be with you all today. And I thank you very much for the opportunity to speak with you.
Anna, thank you so much for sharing that presentation and the information along with it, especially the impact that's being made and some of the good news that's on the horizon. And of course, all of the resources. Thank you again for sharing all of that information.
Thank you, Tanisha.
All right. Well, at this time, we want to now move on to a panel discussion. We've got some kinship caregivers and someone who has actually been in kinship care. But first, I'd like to bring up Latrice Yaya Lumpkin of Franklin County and Siobhan Aaron of Summit County. They have had great experience and being kinship caregivers. And so we want to get their perspective now. These are personal stories as they have welcomed relatives into their home. So ladies, thank you so much for joining us. We appreciate it.
Thank you.
Thank you.
All right, you guys can relax. So we just want to have a discussion here. You know, when you think about your own journeys, just kind of talk to us first about what it was like initially becoming a caregiver. And Siobhan, I'll start with you. What was that like for you, and how did that all come about?
Well, are you sure you want to start with me?
Whoever wants to go first.
No, just kidding. So we have custody of my husband's 4 grandchildren. We've had them for the past 2 years. The ages were when they came into our household were 2 one-year-old twins, a 2-year-old, the twins are girls, a 2-year-old brother, and 9-year-old sister. My son, I've only had one child. He was going into his senior year. So they came to visit one day, and their physical condition, unfortunately, was very dire. And my husband and I made the decision right away to see if there was anything we can do to get custody, but not put them in a system. Their older sister had an experience being in the system a few years prior, and it took about 2 months for family to get her because it was held up in the court. And it was a really rough experience, so we decided to forego that. And because of that, like, my son, almost going into his senior year of high school, did not know the cost of daycare for like what it is now. From the time, like, what it is now for 1 week per child is what it was for like the month for my child. So it's been eye-opening. It's been an adjustment. We're still not adjusted 2 years later, but we're trying. And thanks for just support groups. Yaya, she's like integral in one of my support groups, and without her, I just don't know where I would be. And then other resources. Yeah.
Thank you for sharing that. Yaya, what's your journey been like?
Hi, everybody. My journey, and bear with me because I am going through something with my grandkids. My journey has been hard. I took in my 2 grandkids back in 2018 due to homelessness. They came to me 4 and 6. They are now 13 and 11. And then I just recently got my granddaughter, who is now 15. And it has been a life-changing for me. I got this paperwork. I filled it all out because I thought y'all was going to ask these questions. It is very hard raising my grandkids, and I'm still trying to get the concept. 7 years later for the boys, just a few months with the granddaughter. They come to us broken, neglected, hurt, abused, and we have to put them back together and repair them before we can even love them. And with that being said, we lose who we are in the process because we have to take them on. It's hard. I got involved with KCC support group. Barb Turpin told me about it. So I've been with that support group for as long as it's been. So I think it's been 5 or 6 years. And if it wasn't for that support group, I don't know where I would be. Just getting the resource and the navigations in trying to raise kids for the second time. My mental health has went down. I cry a lot. I'm depressed. I drink a lot. I'm not happy. But it's all in the sake of the grandkids.
Thank you, first of all, not only for sharing, but thank you for your vulnerability. Thank you for your vulnerability.
Thank you.
I'm sure that many who are on here, they may not have your exact same story, but they may be able to relate. So thank you. I am curious for either of you, what's the relationship been like with the parents, and any sort of involvement, or has there been any sort of involvement, and how challenging has that been?
You want me to go, Sharon, or you want to go?
You can go, yeah.
So for my two oldest grandkids, the dad is in jail doing 33 to life for murder. My daughter is the mom of all three of the kids. She was living in Cleveland. She recently came down here to the Columbus area. She is not allowed to live with me. Me and her cannot co-parent together. She's just unstable, and mental illness is real to take care of her kids, and she's stuck in time too. I got her boys when they were 4 and 6, and I sometimes think she think they're still 4 and 6 and they are 11 and 13. So sometimes I have to stop her when she's talking to them, because she talks to them as they are babies, and they're not. They're 11 and 13. My granddaughter is totally messed up, and my granddaughter is her mom, who her mom is now, and it has brought a lot of challenges to my house that are not healthy and not safe, and I'm in the process of trying to get her removed out of my care. The mom don't understand, and I don't have the strength or the energy to make the mom understand. I wish it was tools for these biological parents to get their lives together and take these kids. But as y'all all know, sometimes that is not even the answer.
I'm so sorry, Yaya. My heart just really goes out to you. And if you, I know nothing you can say or do. This is how we live. It sounds shocking, and it really is, just to be thrown in these situations. Like, I planned to have my son. Like, I was like, after I graduate college, things like that, and you just plan your retirement, and now your retirement's gone. You plan where you're going to stay just enough for your family. You put all your energy into raising your kids when you're younger, and then when they got a little older, you got to live your career out, and that's not the case. So I get 4 of my husband's grandchildren, and initially the parents were acting like I work for them, which I don't, even though they, like, the condition the children were in, I can't even revisit, because it's that shocking. And like you say, you put them together, but then the parents, they want to come in and out once in a while. It breaks the kids apart again. You're stuck with the 24-hour day to day, but not even the parents. So what makes this so hard is financially, emotionally, physically, but you have all the other people involved, like my husband's parents, who it's a little different for me, but also not too different, because these are my husband's, like, this is my husband's family. They're looking at me as family, but when it comes to, like, okay, I'm raising these kids, I'm an outsider, and you don't know what you're talking about. But me, like I said, I was at risk for losing my job. I have a PhD. Like, I was in school over 12 years. Like, I got special training, and then I'm good enough to raise the kids, but I'm not good enough to have a say and have stability for my household. And then you have people that want to come over your house day and night, pop up, make side comments, judge you. They're not putting in a day to day or even anything at all. And it also destroys your household. It destroys your routine, and you're stuck again with your life before you had the children to, like, live that life, plus put these little people back together again, have stability. And then the parents had baby number 5 once we got the 4. And then now one of the children is seeing the parents pop up once in a while with baby number 5 and take baby number 5 home. And like Yaya said, she's in the process of removing someone from their home. There's only so much you can do. You want to save the world. Realistically, if I take baby number 5 in, which we've been asked, babies number 1 through 4. Me, my husband, my marriage, like a lot of our marriages are, you planned, you did everything right. People come in and out. It's
hard. It's
yeah.
hard. I'm gonna help you at the end. I know it's hard. Understand that we lose who we are. And what she said, now I don't have what she's going through. All of our testimony is different, but we lose who we are somewhere along the line, and we're doing everything right. And just like she said, I'm doing in the first slideshow just really broke my heart, because here I am doing everything right by my granddaughter, but now I'm trying to get her out of my house before I go to jail or before the boys get taken away from me, because I know emotionally I cannot take care of her. And I'm listening to that video that talked about, I think it was when the child got adopted out by the aunt and how it changed her. But here I am about to go to Children's Services and open up a case to save me from my granddaughter. So it do changes us.
You're also saving the other 2, Yaya. You can't do everything. There's a limit. Saving 1 child is enough. If you can't save 3, we almost had to but almost open up a case for the older child, because putting the other younger 3 in jeopardy, and it's not fair to them. And you have limits, and when you have no support, it's only, we didn't put them in a system, and finding out after the fact that made us like not have support that we needed to take care of these children. My husband and I like worked so hard on the risk of losing everything. It's only because they're our family, you want to give your heart, but it's only so much you can do. And just like their parents can't change, sometimes those children can't change, and you can't. You want to, but you can't. And that's a whole nother load on your shoulders.
You said something. And even in the midst of everything being super, super challenging, what is it that you feel like is needed, not only for yourselves, but for other kinship caregivers, that would be most helpful, or what can be improved? And while everybody's situation is different, what is it that might be most helpful for people, including yourselves, and to improve your situation?
One, I guess the wording, like one of the speakers said, kinship is not well known in the communities or the court systems. I just recently found out that power of attorney is taken away. It's different now, because I don't want custody of my granddaughter. I wanted power of attorney. I actually had to call Barb crying about that. That's different now. A lot of the courts don't understand what kinship is and how it works. Removing a lot of barriers for when we get these kids, because before these kids came into our lives, we had a life, and our financial was for us and not for the kids. So I'm sure a lot of us seeked out resources such as childcare and food stamps, and due to maybe our income, it didn't qualify for us. I know in my support group, a lot of us is going to get mental health. I'm not, because I keep losing people, because our mental health do go down. And we just don't know a lot of stuff for kinship out there. I hear a lot about adoption. I hear a lot about foster care, but you just don't hear a lot about kinship and or grand families. The financial barrier is a stigma for kinship families. Childcare, food stamps, and just navigating the court system to get what we need to take care of these kids. I don't know.
So really having more access and more communication as it relates to all of that, and how to
Yes.
go about it.
Yes, I do know that because this is just fresh in me. I don't have custody of my granddaughter, and the school wouldn't accept the paperwork that I had. And when I went down to court to get power of attorney, they was like, "No, you need the parents." And I said, "Well, one is in jail and one is, I don't know." And I don't want custody of her, but the courts is making me take custody, and I take custody of this girl. I can't. And after talking to Barb, there is a caretaker authorization affidavit. Why didn't they tell me that? Is it because they didn't know, or they wanted to give me a hard time? I feel like the court should be, or somewhere within our court system, it should be like a little kinship department. You got foster care, you got adoption, but what about us that's stepping up to the plate to take care of these kids that's in a kinship care situation? If that makes sense. I don't know if that makes sense.
I agree, Yaya. When we first saw the grandchildren in the conditions they were, we immediately got power of attorney. We had a bad experience with children being in the system, and we just didn't want, the twins were, many people have said like they were a failure to thrive, like they probably would have died just going through, I don't know, that's how bad of a shape they were in. And because we did that, because we said we stepped up right away, the county called us and the doctor reported that. The county called us and said, "Oh, I heard you have power of attorney. We're closing a case." And we're like, "What case? Like, what does that mean?" And then, like, when we go get assistance, because like daycare is like $1,500 a week for 3 people, and they tell you financially you should be able to pay for that looking at it on paper, but like financially, that was my financial picture before like we got these kids. And you're penalized. You're penalized because you're stepping up to the plate. You're penalized because you're not using county resources because you wanted to make it more seamless, or streamlined. So I agree with Gaia. Like, I wish kinship caregiving was in a league of its own and recognized, just like foster care, just like adoption. There's resources for foster care, there's resources for adoption. But if you just went and like straight up as a kinship family took ownership of the situation, you're penalized, which is
Okay. So I want to do this. We're going to pause for a moment. And if we can bring up Tasana, I'm going to come back to you and we'll bring you all back in just a moment. But I want to shift a moment to Tasana Powers.
Hi.
And I want to talk to you for a moment. And then once I talk to her, we'll all get to some questions for everybody. Tasana, you're 38, you're in Franklin County, you have a story of your own. You were a part of being in kinship, right?
I am.
and so just, again, share your journey, your story of what it was like for you and how you ended up in kinship care.
Well, like you said, I'm a kinship kid. It's really funny to say at 38. But my parents got guardianship of me at 18 months, and I was officially adopted at 14 years. My biological mother was a drug addict and an alcoholic.
It's okay. Take your time.
I've done these speeches multiple times. You'd think I'd be better at it. Anyway, she left when Pam, my biological mother, left when I was 2. The only contact I had was in and out of phone calls from like jail. And she was my boogeyman. She told me that that she was my real mother and that she was going to send people to come and get me. But my parents, my mom and dad, kept me safe. They never lied to me. I always knew that I was a child of kind of adoption. But I also knew the struggles that they went through. They're my mom and dad. They let me choose what I called them, and that's who they are. I have sisters through my parents, not biological, but through my parents. But they were in college and in high school when I was in like pre-kindergarten. So same thing that all the ladies are going through of, planning on retirement, planning on, going on all these trips and stuff. And ta-da, 15 years after their, last child, here I came. They were looking for support. And they actually started the Grandparents Raising Grandchildren group here in Ohio and are two of the founders of the Kinship Coalition. So I legit grew up in this program. Having that family connection, having mom and dad and sisters and aunts and uncles and a grandma who was awesome. That family connection was everything. I didn't have to go, well, I think any question I had, they could answer. And it was that connection of, this is not just my family, but like, this isn't just the home that I'm in, like you would like in foster care, but this is my family. This is who, we are. We all have weird, similar traits. Like we all, my stepfather, who is blind, always says that we all sigh in different manners, but it's all kind of the same time. So, it's things like that, like those connections, those pieces of your actual family that you don't think about, how you say something, or little weird things like that you wouldn't necessarily get in a foster situation. You wouldn't feel as loved and connected to in the foster situation. But yeah, so when I was 14, I was officially adopted, and it's probably the safest I ever felt. The court system was always really terrifying because I did have the threats from Pam saying that she was going to come and get me, that they stole me from her. Obviously, alcoholic, drug addict can't really listen to what they're saying if their mouth is moving. So I was safe. And again, it was with my family. Yeah, that's kind of my story. I've gotten a couple of these speeches, obviously, sometimes a lot better than others. I do think there needs to be something more help for the kids, or not just the kids, but the grandparents. Like, I love the support group. That was one of the biggest things for me, because you did find kids that were just like you. Even if the situations were a little different. I had a lot of kids that were, I want to be with my biological mother. I want to be with my I did not. And still do not. But that group, that support, that mental support was so important. And I feel like more awareness needs to be given to the fact that these kids, these parents, these families that are trying to stay together are honestly the best thing for these kids. They're the ones that know them. They're the ones that can get them the help, can get them to that, can connect to them into a different level. And it's not just blood. I mean, to really throw a wrench into it, my biological mother is adopted as well. So there technically is no blood relation between myself and the rest of the family. One of my other sisters is adopted too. But we're family. Like, this is who I grew up with. This is the people that know me the best. And I think, honestly, in my true opinion, that if you can connect kids to their families in any form, aunts, uncles, grandparents, and you're able to help them, and I think the state needs to help them, it's by far better for the kids.
Just curious, as you started to talk about some of the challenges in your relationship with your biological mother, what were some of the other challenges maybe that you faced beyond that? And I don't know if it was in school or at home or even just connecting with other people.
So we had a lot of trouble with teachers at school. We had quite a few interesting ones that would insist that they were my grandparents. And that, of course, as a kid who was very attached and very, no, these are my parents. My parents had to step in quite a few times. I know it's a big thing. It's a thing now where kids have passwords for people to pick them up and, things like that. I had to have that back then. And that wasn't a thing back then. Not really. If we saw strangers on the playground, I knew that I had to go inside. Like, that wasn't a thing for a lot of other kids back then. That wasn't, something that was really implied, however many years ago. We're not going to talk about that. But that was a challenge. When my parents just had guardianship, my mom tried to get me shots for school. And state went, "You're not her parent. You can't get her shots." And so my mom waited a week. We went back and she may have fibbed a little. And she was able to get me my shots. But that, getting me tested for dyslexia, ADHD, which of course I am, were all extra challenges because there wasn't that support behind grandparents, behind non-parents. And so we ran into that a lot. I mean, my family was always really supportive, so I had that, which was great. My friends would be like, "Your parents are really old." I'd be like, "Yeah, that's okay." Yeah, everyone was really involved. My dad was almost at retirement age, so he kind of did retire and he did all the mom things. He went to all the camps and the school trips and stuff like that. So, and again, but the kids would go, "Wow, your dad's quite old." You'd be like, "Okay." But yeah, we ran into a lot of that, or we'd be out or something like that, and people would see them, "Oh, look at you and your grandbaby," and my parents were like, "No, they're my kid. She's my daughter." And sometimes they would get looks, and so you always ran into stuff like that. And honestly, I saw it when my mom would go and talk to the court systems and talk to people for help. They again would go, "Well, you're just the grandparent. This is not our problem," kind of thing. So we ran into a lot of that kind of stuff. But as far as school, I think was the biggest thing. It was just we had to run into a lot of teachers that would argue with me about who my parents were, and we had to implement all of those safety things, which were a little terrifying. You're 6-7 years old going, "Okay, if there's a stranger on the playground, I need to run inside right now because who knows."
That's a lot to navigate as a kid.
It was.
Just curious, looking back on your story, when you think about all of the benefits of being a part of kinship care, what comes to mind?
Honestly, it really is that connection, that knowing that I've never missed a piece of me. You have kids that are like, "Oh, I really, really miss, my mom," or "I really, really miss my dad." I had a mom and dad. I had sisters. I had aunts. I had that connection. I had that whole. I was whole. I didn't feel like I was missing something because I had them. And I knew that they were technically my grandparents, but that's not who they were to me. Does that make sense? Like, I think just that, and honestly, in all honesty, having older parents, one, was bad because I didn't get away with things because my sisters did it all before me. But I also got to experience a little bit more. We went camping. We went on trips because, again, they had, planned on retiring, and now they're like, okay, well, we're gonna not do that, and we're gonna raise this grandbaby, and it was fun because, again, they did have more experience, and so I was able to personally experience more. Now, I know that's not the case with everybody, but I also think that having gone through other children first, they not only could I get in trouble faster, but they also knew the tricks. They also knew, okay, so it's raining outside. Let's roast marshmallows over a little candle or something. They knew those things, and I think, honestly, that's it, one of the best things. And again, you have those traditions because it's your family, and I'm able to move those traditions onto my own children. I have a 12-year-old daughter and a almost 7-year-old son who is definitely has some energy.
Awesome. Thank you so much for sharing that. If we can bring back Yaya and Siobhan, just a couple of more questions for all of you. And I just want you all to kind of think about this for a moment. For those of you who are caregivers, what is your hope for the children that you are taking care of? But then also, for everybody, when we start to think about policy and legislation, what's needed? What do you want to say to legislators? Where do you think things need to go from here? And I know there's a lot of questions, and I'll repeat if I need to, but just kind of think about that for a moment, and anybody can jump in at any point to share.
I'll go. This is Yaya. So in the beginning, when I took my grandkids, the understanding was mom was going to get her life back together and take her kids. Well, I'm going on almost 8 years later. And if she ain't got her life together now, she's not going to get it together. So I appreciate everything that the young lady said about her parents raising her. I'm not sure what her age is, but me and Siobhan is in a different age or era raising these grandkids. I'm competing with social media, all of that stuff. And so I feel like I'm at a point where I cannot teach my grandkids, especially my granddaughter, anything. So I just made it in my mind and point that I'm gonna continue to get her the help she needs with the understanding that I'm transitioning her out of my home. As far as the legislators and policies, I had wrote down that kinship families need to be recognized like the foster care and adoptions and get the same resources and benefits and financial help so we can continue to take care of these kids that's in our care that we did not prepare. Like, I didn't sit down one day like, oh, okay, I'm going to take my grandkids and be miserable for the rest of my life. I didn't want that. Remove the barriers to get the food stamps and the child care. I know in the beginning, that's all I wanted, the food stamps to feed them and the child care that I could continue to work. Easier to obtain the grandparent power of attorney because of what I just recently went through down at Franklin County Courts was horrible. Making it a little bit easier to get these kids in school and to see the doctors because I don't have legal custody of Shayla, because I don't have custody of Leilani, I don't have rights to my chart. I don't have certain rights to her and her care. Because I got kinship over her, but I don't have custody of her. So I don't have say-so in like her medical needs. And And I wish that courts just had a better understanding of kinship and what us grandparents, a better understanding of kinship and the grandparents when we come down there to get kinship care of them, of the little ones that we got to take care of.
Thank you for sharing. Siobhan or Tasana?
Can you repeat the first question?
No problem. So the question was about what is the hope for the kids that you are caring for? And then is there anything that comes to mind that you want to say to legislators or what you would like to see when it comes to policy?
So my hope, because I have children of all ages in my custody, so there are 3 now, the youngest ones, they came to us at 1. And it's not so much of a nightmare to them as it was even like the one who's 4 now and the one who's 11. My hope that they grow up strong, they can see the difference in different lifestyles and wanting to actually have a stable home later in life. And I know it's not all about a choice. Like, I know a lot of people with addictions and mental health problems, not to say that's an excuse, but they don't choose to not be parents. And I have to explain that to our 11-year-olds a lot, because she acts out sometimes when she misses her mom. I tell her like their first priority is maybe that substance that has a hold on them, or like just even coping every day with their mental illness. So I hope that they can see like how much we love them, how much we want them to succeed. I hope they can just carry that with them and continue to be full. I know there's a lot of broken things that they're carrying. And I hope they can thrive ultimately from having that past. And I hope they can just make the future brighter. My husband thinks, I told the parents to get it together because we're giving them back next year. He said that for like the last couple of years, and that's not how it works. And this year I told him, let's start thinking about adoption. But I just hope for legislators that there are some considerations for kinship caregivers, just like there is for adoptive parents and as well as foster parents, because children staying in a home with people who love them, and ultimately we still carry the same family connections as they had with outside extended family. So I would just hope that there would be this would be implications for policy changes specific to kinship caregivers.
Thank you. Tasana?
I'd like to see it being educated out there. Politicians, teachers, nurses, social workers. Again, because you have those teachers that go, oh, you're just the grandparent. Grandparent is still a parent. And particularly in that situation, or any of our situations, you are the parents. And I think that it needs to be educated out there. I think there needs to be not just resources and stuff, but just regular education that, hey, watch what you say. Support these families that are taking kids out of, that are keeping kids from foster care, that are keeping kids out of the system. They sit there and they complain about the foster system is so high and that kids get lost in it, and you take them out. It's but it needs to be educated. It needs to be something that we are teaching everyone, just as I guess I don't want to say normalized because it's not really normalized, but kids are in foster care. Okay, cool. Teachers know or at least feel like they know how to handle that situation. Okay, well, kids are with kinship kids. They're like, who? What? Every school I've had, like with my own children, I've met parents, grandparents that are, or aunts and uncles that are raising their kids, and they just don't have that information. And I know I've sent several people, a lot of people, to the Kinship Coalition groups and going, here's where you can start. Here's where I can at least help you get that direction, kind of thing. But there just isn't enough education out there for the higher ups, the politicians, the nurses, the teachers, the social workers. That at least in my opinion.
Can I piggyback off of Tasana? The 11-year-old at school, when teachers kept saying, oh, the grandparents, like you say, like we're parenting her, we're her parents. Well, she got bullied by like being in sports clubs and with not only the children, but their moms, like, oh, it's like a stigma, like, oh, her grandmother is raising her, so she must be like a troubled kid, or she must be from a troubled background. And actually we had to stop participating. And I'm from a generation like where we kind of, bullying, like to me is not, I don't know how to say this politically correct, but I'm from a generation that bullying was not a barrier. Yeah. So for me to even say like we have to take her out because like one parent was like, oh, this is her grandparent because this was told in the school, and then it went to other parents, and now people are treating the child differently because of that. But I was like, we're in a stable home, we're giving her, it's not so. And then too, being in a stable home with grandparents, like, is stability, is love, is so. I thank you, Tasana, for bringing that up, like just educating teachers and authority figures.
Can I piggyback on you and Tasana to piggyback what she said, the educational system? And I think the last number I seen is 2.5 million kids being raised by grandparents or any other kids. And you're right, a lot of the teachers, a lot of educationals in the school system didn't know. And I think sometimes that's why the kids have such a hard time in school, because like you said, the teachers may or may not treat them different. And I am in another support group that's through a school where the principal never even heard of the word kinship care. She knows now, but it's sad to say, I don't let them call me the grandparent. I'm Yaya. You will hear them say, oh, here come Yaya. Not, oh, here come the grandma. Oh, no, I'm Yaya. We not about to put a stigma on who I am for these grandkids, because you're right, they do treat them different. And I am well known through the school. It's bad. Oh God, here come Yaya. Yeah, here come Yaya. I don't let them call me grandma. I'm Yaya. And it makes a difference because you don't know who I am. You just know I'm Yaya. You really don't know if I'm these kids' mom or if I'm these kids' grandma. And really, y'all don't need to know. I'm Yaya. That takes care of these kids. So it'd be easier on the kids and for them in school, so they're not bullied. So they're not. And I do talk to are y'all okay? How is school? Are they saying anything? And so far, so good. Knock on wood. They don't get, as you know, Shavonna, as you say, bully, or, because it is a lot of grandparents raising grandkids. And it is, that's just where we at in this era. But educating the school.
I want to do this. Each of you just take 30 seconds. And it's, what would you say to anybody who is listening today or who will listen to the recording, who is a kinship caregiver or someone who is in kinship care? What's something that you would want to quickly say to them?
Can I go first? I tell this to I do Alzheimer dementia caregiver support groups in education. And I tell people that you have to take care of yourself first, because your self care, your state of being directly affects the care recipients.
I'm gonna go behind you and say the same thing. Like I had lost myself along the line taking care of these kids. I'm in Angela's support group, and we talk a lot about self-care. Prioritize yourself. Take care of yourself. Get self-care. Get your mental health. Because if you're no good, then how are you going to be any good to your little people or big people that you're taking care of? Seek out support, a support group, get friends who understand what you are going through, because not everybody's going to understand your emotions and feelings of being a kinship caregiver.
I'd say, yeah, find that support group, because you've gone from the big kid chairs back to the little kid chairs unexpectedly. Find your village, find your people, and help your kids find their people.
Thank you.
Thank you all so much again for sharing your stories. I recognize that some of this was not easy today, but I do believe that your stories were super helpful for those who are able to listen now and those who will listen in the future. And just know that your labor is not in vain. So thank you again to all of our panel members. And at this time, I want to take a moment to acknowledge and thank our sponsors. So let's welcome back Barbara Turpin to help us do that.
I want to just say that the caregivers and their stories are so powerful. They, in order for people to understand kinship, they need to hear the stories. And this is something that we've supported, and we've reached out to caregivers to continually tell their stories to as many people as they can. And as you heard how powerful they are, they can make a difference. And I think sometimes they don't see that in themselves, but they can. They're the ones that make a difference. So thank you very much for disclosing and opening up your lives and your hearts, for the children. And on behalf of the Ohio Grandparent Kinship Coalition and the Ohio Federation for Health Equity and Social Justice, we want to express our thanks and gratitude to Rita Sorinen and the Dave Thomas Foundation for Adoption and the Amgen Corporation for their generous support of the symposium. Without them, this wouldn't have been able to happen. It didn't happen, without financial support, and they were there to do that. And they've been there for us over the years. And we appreciate the wonderful partnership, and we would not have had such a successful event without them. Thank you.
All right, Barbara, thank you so much for that. I want to turn it now over to Brenda. We're going to talk a little bit about the evaluation as well and what comes next.
Good evening. You should receive an evaluation, as Barbara stated earlier in the presentation. In order to be eligible to complete to be eligible for the gift certificate, you must complete an evaluation, giving your feedback on today's symposium. The information obtained from the evaluation will be used to plan future initiatives on behalf of OGKC and the Federation. At this time, can we get the link for the website for the evaluation? Okay. Okay. Well, while we're waiting on the evaluation link, I would like to say thank you to the panelists for sharing your stories. Before officially closing, I have a special award I would like to present. This award is in recognition of our board president, Ron Browder, in honor of his 25 years of service to the Ohio Grandparent Kinship Coalition. The award is from the Ohio Grandparent Kinship Coalition in honor of Mr. Ron Browder's 25-year recognition from the Ohio Grandparent Kinship Coalition. We give you our sincere gratitude and thanks for your steadfast dedication to and the generous support of kinship families everywhere and caregivers. 2000 to 2025. Thank you, Ron, for your unwavering support and contributions on behalf of Kinship Care families. And for those in the audience, the award was just presented. In closing, we thank everyone for their time and contribution to today's symposium. Especially, we would like to thank Tanisha Johnson, our Mistress of Ceremony, Rita Sorden, President and CEO of the Dave Thomas Foundation for Adoption, Anna Beltram, Director of Grand Families and Kinship Support Network, Ohio State Senator Herschel Craig, Ohio State Representative Dontavius Gerald, as well as Senator Michelle Reynolds. We also like to thank Governor DeWine for his contribution in preparing the proclamation for the state of Ohio in honor of Kinship Care Month. Buoyant Partners team, the production team, Catbro team, Lisa Stanford of the Ohio Federation for Health Equity and Social Justice. Last but not least, we certainly thank our Kinship Care families. You are the backbone and hope for countless children across Ohio. You carry stories of sacrifice, courage, and unconditional love. Without you, who would they have? We hope that today's symposium has provided you a space to gain additional tools for success as you continue your unique journey of kinship care and advocacy. Thank you for attending. A recording of today's symposium will be available on the Ohio Grandparent Kinship Care Coalition website later today.
Thank you so much for that. And thank you all so much for spending your time with us today. We greatly, greatly appreciate it. We hope that you got much more maybe than you even anticipated you would get out of today. And I do hope that even as you go forward, that you will keep advocating. Thank you again for joining us for the 2025 Kinship Care Building Resilient Families Virtual Symposium.